Not enough milk for health workers. A common concern of a new mother is whether her baby is getting enough milk, especially since she cannot measure the amount of breast milk the baby is drinking. Fortunately, there are other ways to know that a breastfed baby is getting enough milk. This video will show signs to tell whether the baby is feeding well and how to increase the baby's milk intake. The first sign to tell whether the baby is getting enough milk is the passing of stools and urine, especially in the first few days. Colostrum, the early milk, acts as a laxative and helps the baby quickly pass meconium, the sticky black first stools. As the baby drinks more milk, the stools become lighter. By the end of the first week, the baby should be passing loose yellow stools. If meconium is still seen on day 4, this is a warning sign that the baby is not getting enough milk. Frequency of urination is also a helpful sign. In the week after birth, a baby should generally urinate 1 time for each day of life. Once on day 1, twice on day 2, 3 times on day 3. After the first week, he should be urinating at least 6 to 8 times a day. The second sign is whether the baby is drinking well. Seeing her baby take good, deep swallows tells a mother her baby is feeding well. Help her recognize when her baby is drinking from the breast and not just suckling. Show her the movement of the baby's jaw. When the baby is drinking well, there will be a pause and drop in his jaw as he swallows. Watch closely. The baby is sucking and swallows. Suck, swallow, suck, swallow. This baby is not well attached. He's making short, quick, shallow sucks, then rests. His jaw does not drop low to show he's swallowing milk. He's only suckling, not swallowing at all. Babies who are only suckling at the breast soon get sleepy. A mother will often think her baby is full, but he may simply have given up and will soon waken and need to feed again. Now, watch the deep rhythmical motions of this baby's jaw. Each suck this baby takes results in a swallow of milk. He is drinking very well. See the difference. This baby takes only rapid, shallow sucks and is very sleepy, compared to this baby, who is drinking well and is very alert and awake. The third sign is the baby's activity level. A baby who is getting enough milk is alert and active when feeding, and feeds at least 10 times between one sunrise and the next. If a baby falls asleep within the first few minutes of breastfeeding, the flow of milk is probably slow. The young baby who has trouble being aroused may not be getting enough to eat. If the baby is not waking for at least 8 feedings a day by the end of the first week, this is a warning sign. If a mother thinks her baby is not getting enough milk, how can she increase her baby's intake? First, improve the attachment. If the baby is attached only on the nipple, the baby gets very little milk. But when he takes more of the breast in his mouth, milk comes easily. This deep attachment enables the baby to remove more milk from the breast, which then stimulates the breast to make more milk, enough for the baby's needs. Babies may not be well attached, but because the mother makes abundant milk at first, babies may thrive. Over a few months though, if the baby is not well attached, he won't take all the milk the mother is making, and her supply will decrease. Her baby will start to be restless at the breast, pulling or slapping, and may reject the breast entirely, or feed for very short periods of time because the flow of milk is not meeting his needs. To prevent that, observe the mother breastfeeding and guide her to improve the attachment right from the start when the baby is a newborn. Next, compress the breast. Compressing the breast will improve the flow of milk and keep the baby drinking. If the baby falls asleep quickly at the breast, compressing will start the milk to flow. The baby will start to swallow and wake up as the milk comes. Have the mother press her breast between her thumb and fingers as far back from the nipple as is comfortable. Pressure should be firm but not painful. Suggest she compress while the baby is sucking and rest while the baby is resting. If the baby is drinking well, there is no need to compress. And last, feed the baby often and well. In the early days after birth, the baby will be hungry often, at least 10 times between one sunrise and the next. A newborn's stomach is small and breast milk is quickly digested. Encourage the mother to follow her baby's signals. He is able to tell her what he needs. Holding her baby skin to skin on her chest to start her feeding helps her baby to calm and organize himself. Teach the mother to respond to her baby's hunger signals. Sucking motions of his lips, bringing a hand to his mouth, and turning his head from side to side. Encourage her to feed her baby whenever she sees his feeding signals day and night. There is no need to time how long the baby feeds or remember which breast he was last on. Some babies are fast feeders and others are slow. The baby will know when the flow on one breast has slowed and he is ready for the other side. As the flow of milk slows, the baby comes off the breast on his own. The mother holds her baby to her chest. As she patiently waits, her baby starts to signal his hunger. He was interested in going back on the breast twice more. Full at last, the baby falls asleep and drops off the breast. At times, the baby may suddenly want more milk than before. This is normal. It means the baby is growing, and so is his hunger. As the mother follows her baby's signals, she will feed him more often and naturally increase her supply of milk. Do not give the baby water, sweetened water, tea, honey, breast milk substitutes, or anything else. They can fill up the baby so he won't feed as much at the breast. This will reduce the mother's milk supply. They can also give the baby harmful germs and make him sick. Instead, follow the baby's signals. Feed the baby often whenever she signals her hunger. After a few days of extra feeding, as long as the baby is well attached and the mother is using compressions to make every feed effective, the mother's milk supply will grow to meet the baby's needs. Breast milk is best. For the first 6 months of the baby's life, this is all he'll need. It has all the nutrition in just the right amounts for the baby to grow and thrive. Remember, almost all women can produce all the milk for their baby's needs. The baby is getting enough milk if he's passing stools and urine normally, drinking from the breast, and is alert and active while feeding. When a baby is well attached and fed as often as he's hungry, the mother will make plenty of milk.